I'm Mike Macharia. I would say I'm a serial entrepreneur. Been in technology for several years, maybe 20 plus, and healthcare for the last 6 years. And Ponea is one of those ventures that we started as one of the founders with one of our partners and one of my co-founders, Akshay, focused really on the next delivery in healthcare using technology, but we'll talk about it later.
I'm Akshay Shah. I've been in the manufacturing business across Africa for just under 30 years. I've got a background in IT. And 5 years ago, I started to think about, how can I get back into IT? And along the journey, started getting involved with tech startups, with tech-enabled companies. And Mike and I had a discussion, I think, late 2019, and he talked about how he wants to disrupt healthcare using technology, and it was just music to my ears. So here I am as a co-founder with Ponea, along with Mike.
Well, my name is Peter Ndiangui. I'm an e-commerce digital marketplaces expert. I've been in the e-commerce world for over 10 years now. And I'm an entrepreneur myself. I run my own e-commerce on-demand platform. Also, when Mike came to me and told me that he was having this idea about healthcare, which also relies on almost on-demand e-commerce, I was quite excited to join on the board. And I looking forward for what we are doing, solving healthcare problems not just in Kenya, but entire Africa. And I think this is going to be one of the best opportunities in healthcare growth, not just in the urban areas, but also we look forward to getting even where there is little or no access to healthcare.
The Ponea story is quite interesting in that even at the point when we chose the name Ponea, it only happened 7 months after we started working on solving the big problem. Having been in technology and healthcare for several years, it was pretty evident that I did lots of healthcare interventions around business to consumer, or business to government, or business to business, where you either building infrastructure, you either building supply chains, but then a whole new world opened up where you realize that you didn't have to own infrastructure, you don't have to own the caregiver, but then technology was enabling service delivery for the patient. And then when we looked around, we realized that you look at Airbnb, they don't own infrastructure. I don't have to own hospitals. We don't have to own hospitals as Ponea, but we still can, at the center of our core is heart of the patient in terms of how can we deliver that unique experience for the patient at any one moment, either by giving them better convenience, better value for money, and also to make the whole healthcare delivery and the whole healthcare experience for a patient be something that they don't dread to go look for healthcare, but they would welcome because it's convenient. So when you think about Airbnb, you think about Uber, for instance, and you think about Uber in our business is the doctors. We don't have to employ doctors. We don't have to own their facilities, but we can provide traffic to them. And when you think about e-commerce marketplaces, we don't have to own stores, we don't have to own drug stores, we can bring everything together. And for us, when I looked at that, I realized the complexity in that whole ecosystem. But how do I bring that, how do I simplify that complexity? By bringing very simplistic patient experience using technology. That is a lot to say because you're talking about very complex systems in the back end. You're talking about simplifying how patients look at healthcare in terms of devices, in terms of whether it's concierge services. And then based on that, we then put all of that together and came up with the whole Ponea value proposition. And then we said, then we need a name for the brand. We need a name to build. We need to build this global platform or global organization such that where we go, what we say, when we say our name Ponea, people could relate with it. And we spent interesting times together looking at what name do we get for how do we build a global name, a five alphabet name that is easy to remember. And we thought what is the one thing that we struggle with when we look at health? Many people say, oops. I just went, oops. It's always about an oops situation. And we thought, oops in healthcare in Swahili is saved, right? So we thought about it. How do we then have the name? How do we convert the name saved into a Swahili word, which is called Ponea, kuponea? Then we said, why don't we have the name Ponea? So Ponea for us is saved by a whisker, which talks about using technology at the right appropriate time, from a convenient way, in a convenient manner, to be able to look for healthcare services. So today, I could be seated here, and I feel I need to see a doctor. I could grab my phone, look at the best price, be able to do a teleconsult, and be able to have the doctor consult tomorrow or today afternoon. And to me, I think that is our vision of how do we reduce the barrier between doctor and patient, and provider and patient, and service delivery partner and patient. And that's how Ponea came into being.
Another way to look at who is Ponea is the people who came together around this vision of that Mike just described. So obviously it's Mike, myself as founder and co-founder, but we knew that we can't do it alone. This idea and the problem we're trying to solve is so big that it needs a team of the right people. So we started looking for the right investors, for the right board members on our advisory panel. And I would say we've assembled an amazing team. We've got people who have been part of billion-dollar startups. We've got people who understand global FMCG, global governance, audit and risk, finance, clinical, public health. I think the diversity that we have on our advisory board, who are all investors, by the way, is just phenomenal. And they are there to really provide us, as well as our team, direction, experience, guidance as we grow this company. We ultimately see Ponea as being a global disruptor and democratizing healthcare. So as we expand, we need to obviously be guided by good governance, we need to be guided by good investors, and that's kind of, I would say a fantastic foundation that we have built with an amazing advisory board. And they are there to guide and support the team, which Peter's going to tell us about.
Yeah, I think the other way also of, in addition to who Ponea is the actual team operating in Ponea. And you look at the team that has been assembled again in the operations of Ponea, right from the clinical team that actually helps in triaging patients as they call in or as they make bookings of Ponea. Such a fantastic team. And next to that, we also see some of the strengths of highly qualified young people coming out of our institutions that are ready to take up digital healthcare to the next level. And that forms the other part of the team that actually drives Ponea operations every single day. Next to that is the folks who are doing partnerships with the various healthcare facilities, various lab services entities around the country. And again, we see there that we have done a great job in bringing together people who have been experts in developing relationships. When it comes to the technology team, again, both local and global, Ponea has pulled together some fantastic teams that are working on cutting edge and technology of linking up the service providers and patients. So if you really look at it as a whole, Ponea is not only doing a great investment in healthcare in the country, it's also bringing together different talents in a horizontal way of thinking that then means that we can improve healthcare and take it to the next level.